After performing resisted neutral testing and finding weakness in finger flexion, you can perform 4 manual muscle tests to assess finger flexion. The first manual muscle test is for the lumbricals. First, have patient's forearm in mid-position supported on the table. To screen the lumbricals, place your index and middle finger on the palm and instruct patient to flex the MCP joints while maintaining IP extension. For the manual muscle test, instruct the patient to flex the MCP joints while maintaining IP extension. Therapist should apply resistance on the volar surface of the proximal phalanx and the dorsal surface of the middle phalanx towards MCP extension and IP flexion. The next manual muscle test is for the flexor digiti minimi muscle. Have patient's forearm supinated and supported on table. To screen for the flexor digiti minimi muscle, stabilize the metacarpals and instruct the patient to flex the MCP joint of the little finger while maintaining IP joint extension. For the manual muscle test, have patient flex the MCP joint of the little finger while maintaining IP joint extension and apply resistance on the volar aspect of the proximal phalanx towards extension. The next manual muscle test is for the flexor digitorum superficialis muscle. Have patient's forearms supinated and supported on table. To screen for the flexor digitorum superficialis muscle, stabilize the metacarpals and the proximal phalanx of the finger being tested. Have the patient flex the PIP joint of that finger while maintaining DIP extension. This muscle may be palpated on the volar surface of the wrist between the palmaris longus and flexor carpi ulnaris tendon. For the manual muscle test, stabilize the metacarpals and the proximal phalanx of the finger being tested. Have patient flex the PIP joint of the finger while maintaining DIP extension and apply resistance on the volar surface of the middle phalanx towards extension. The final manual muscle test is for the flexor digitorum profundus muscle. First, have the patient's forearms supinated and supported on a table. To screen for the flexor digitorum profundus muscle, stabilize the proximal and middle phalanges of the test finger and have patient flex that DIP joint through full range of motion. For the manual muscle test, have the patient flex the DIP joint through full range of motion and apply resistance on the volar aspect of the distal phalanx towards extension.